everybody. This is Reverend Doris Smith, and I welcome you this evening to St. Mark Missionary Baptist Church, where I serve as pastor. And I also am blessed to be an employee of Agape Care, South Carolina. St. Mark and Agape have joined in this evening to educate, to give a program of education on how COVID-19, or as some say coronavirus, how it has affected the way we conduct funerals in the African American community. I want to say to you this evening, we have a great panel here, and they're going to answer a lot of questions for you. But before we do that, one of my colleagues, Mr. Leurs, is going to tell you a little bit about Agape Care, South Carolina.
Thank you, Pastor Doris, and thank you for the invitation to come this evening. I think it's a topic that really needs to be discussed, because that's one challenge people have during this virus crisis that they really don't know how to address, perhaps. I hope this evening opens people's eyes about some of the options and changes that are there, and some that have to be endured, and some that are new things that may have a new opportunity that wasn't there before. Agape Care South Carolina is a new name, so I just want to spend a minute talking about that. Hospice Care of South Carolina and Agape Hospice were two side-by-side companies for years and years across South Carolina, both providing hospice services. Back in January, Hospice Care of South Carolina acquired Agape Hospice, and both relatively the same size companies, and we've been working over the past several months to combine, and now we've officially done it for Agape Care South Carolina, and now we have a company that's twice as big as it was before, many more resources, and I just think it's a wonderful thing that's happened this year to give us a bigger and better chance to help people that need hospice services. Hospice services can be a huge asset to somebody facing a life-challenging situation where perhaps they're in their last months of expected life. When someone has an illness that is past the point of being curable, that is when hospice services step in. But our focus is not dying. Our focus is on making each day the best it can be in that time that patient has left. I became familiar with hospice services when my dad needed it back in 2004. He had emphysema, and his life had deteriorated to a point where it was really a bad situation. He was having multiple ER trips each and every month. His mood was descending. He was getting very anxious and scared, I guess is the best word you could say. Hospice services came in, and he was on hospice for the last 8 months of his life. I have to tell you, those last 8 months were a complete turnaround. His mood was better. He had one more ER trip those whole 8 months. He was much more able to function with the people that came by to see him. And it was just a tremendous gift that hospice gave our family for my dad to have a more meaningful and enjoyable time in those last 8 months that he had on this earth. And that's what hospice services is all about, supporting the patient and supporting the family to get through that difficult time in their lives. It's not just for the final days or weeks of life. Sometimes people think hospice is called in, and that means that a particular person is going to not be with us next week or 2 weeks from that. We have patients that we felt for many months, and similar to what my dad's experience was, helping them through that time, and that's what we can do. Now, we can also help somebody that is at the very end, that is maybe looking at the last couple of days or last couple of weeks, but to get the full benefit of hospice, it's even better for us to come in before that stage comes. Another thing that comes up sometimes is people think that hospice is only for cancer patients. Back when hospice first formed, it was for cancer patients, but that was back decades ago. Now we serve people that have a terminal illness no matter what it is. It could be dementia, it could be end-stage lung disease, end-stage heart disease, Parkinson's disease, and of course it can be cancer as well. But we're there to help the patient, to help the family through that time, no matter what their diagnosis is. The other thing I wanted to cover a little bit about hospice is that the patient and the family remain in charge of their own care when hospice services come in. come in and assist. And we're only there for as long as the patient or hospice family wants us to be there. If they ever change their mind, decide we're not a good fit, then we're happy to leave and be available if they ever need us down the road. What does hospice services provide? Well, it can be as much or as little as that family and patient want. The one person that has to be part of the care plan on hospice is the nurse. The nurse would come on a regular schedule and be there to be eyes and ears for the doctor, keep that patient from having to go back and forth to the doctor nearly as often, make sure the prescriptions are being refilled, answer any questions that family has. And the really nice thing about the nursing component is one of our nurses will be on call for that patient 24 hours a day, 7 days a week, have their own emergency 911 system where they don't have to worry about going to the ER. We'll come to the house and help them through those crisis points. The other people on that team, the aide, the hospice aide is available to come out and help with personal care such as bathing, maybe fixing a little bit of a meal, doing a little light cleaning in the main living area. They're really a companion and an asset to the caregiver and the patient. And it's often that person that family is going to see more often than anybody else on our team. It's a hospice aide. They do amazing work, and we're blessed to have the team we have. 2 other people available to help that family are optional, just like the aide is optional. One is a social worker, a problem solver, a resource finder, a great asset to that family. And the last one is the chaplain. They are there for spiritual support and not to replace a pastor or preacher that the family already may have a relationship with, but to be a new asset to them on top of that, if they so desire. And the other side of our services, outside the people side, is the medical equipment supply side. When a hospice patient comes on board, if there's any equipment they need that would make their life better, could be as simple as a cane or a walker, could be oxygen, it could be a hospital bed, it could be a bedside commode, it could be a chair for the shower, whatever they might need equipment-wise, we're going to bring into the home to make their life better and easier. We also supply supplies, pull-ups and briefs, gloves, pads for the bed, lotions to keep the skin from breaking down. Those type of things are all supplied as well. A big question I get a lot is who pays for hospice services? Well, the nice thing is that hospice is a benefit under Medicare and Medicaid. Medicare and Medicaid both cover hospice services fully, so there's never a bill if you have Medicare or Medicaid for any hospice services. Private insurance also covers hospice in most cases, and as a company, our goal is to make sure that the lack of funding is never a block for getting hospice services, so we'll try to work through that. If you don't have Medicare, Medicaid, or private insurance, we'll try to have our social worker with you to find a way that we can supply services even without payment. So that is an approach that's available. One last point I want to make is you kind of picked up hospice is a team approach on our side. The doctor that originally makes the referral, our medical director are in the background, people coming to the home, the nurse, the aide, the social worker, and the chaplain. We're there as a team, and we look at it as a team on the other side too, on the family side. The family is there as offering support, the caregivers are doing their job, and we're there to help both those sides come together and give that patient and that family an easier time and a less stressful time during those final weeks and months that someone has to be with us. So thank you for allowing us to sponsor this event tonight. I think it's a wonderful topic we're discussing that needs to be talked about. Doris, I'll send it back over to you.
Hello again. We also have with us
I look at it as a thing I say. It doesn't matter where your faith belief is. All of them have prayer instituted in them all. One of my mottos I tell the family, either by via phone call or via in person with them, I said prayer will go further than I can go. It will stay longer than I need to stay. And it will change what we can't change. And I share, I'm one of the biggest cheerleaders on our team. I tell you, this is a ministry. And you have the opportunity to be with a family and a patient in the transition. I have shared stories with family. I have seen patients after just being a support system for them to see accept Christ on their transition on the way out. When a pastor knows that he's got assistance, not taking over, just assistance to help him along with his sheep, it's a great asset. And I think I'm one of the blessed people in the world that can be there at that time, critical time. And what I call a unit of care. What do you mean by unit of care? That person who is taking care of their loved one, whether it's that husband taking care of the wife taking care of the husband. Here, he is going to be his way. When you hear the word caregiver, listen what you're saying. Caregiver. You are constantly giving care. So the question is, what I mean? Who's praying for you? Who's helping me stay strong? That's where the role of the chaplain comes in. That unity of care, not only for the patient, but the family as well. Because I remember going to a seminar years ago for a chaplain, and the theme of it was, you never died before. They are there. And can you imagine? You got a diagnosis saying that you are X amount of time. And you got all this running because one of the days I tell them, they were walking around just like me. It was talking just like me. But here's life, those that curveball. Sometimes this may sound crazy, this may sound strange, especially coming from a pastor. There may come a time when a family, you got to be prepared to give and at any cost. There'll be a time I don't need the scripture right now. I want to pray right now. I just need to eat. I found out one of the greatest support system anybody can do is listen. And once you do that, you'll find out on this journey is well worth the ride. And so just tying this all together, chaplaincy is providing spiritual support, our presence, and prayer. That's where it includes scripture. That's included somebody said a song. But I find just being there, I don't want to step on it like Pastor Smith, and I don't want to do that. There are times when they was able to get the church. And the church, they were there for the church. But what about when they don't go to church and the church is not there for them? That's fine. I see it so often now. My grandmother was 104. Just said it was 104 Friday. And it gives me glory that they go to the community with her. And then we go to hear family singing. You know, my pastor had been by in a long time. And I said, the word, I've been pastor, but I've been pastor. You can send anybody you want. They want to see the pastor. And that's why chaps is so important now. Because especially in this pandemic time, one of the challenges, maybe David Harris said, one of the challenges for the chaplaincy now is the biggest fear of man is coming home. They know you go in one place, and you're going to let them come to me now. I want you to come and pray for me. But I don't know what they bring me. And it hurts now because you can't get there, they'll see. But the challenge is, how can you find a way to get to them when they know they still got support? So I guess that's where the mind is going. Even
All right, thank you, Reverend Woods, and also Don. Now I'm going to tell you about my role with Agape Care. After our patients pass, I serve as the bereavement coordinator. I'm blessed to be one of 7 certified bereavement counselors with Agape Care throughout the state. After the death of the patient, I come in and I give our family support for 13 months. I do that through phone calls, through letters, newsletters, cards of encouragement, whatever it takes to give them the support they need. That's what I do. And many times, you know, sometimes I pick up the phone and I'll call somebody and they'll say, I am so glad you called me today. I really need somebody to talk to. So one of the things about hospice, service doesn't end after the patient passes. But after the patient passes, we're there to give you bereavement support. And we're there for 13 months. And now, to the meat of the matter, what we're here for. The main thing we're here for tonight is to talk about how COVID-19 has changed the way we conduct funerals in the African American community. And we're blessed tonight to have with us 4 morticians that serve Marlborough County. And they're going to come around the table at this time, and when they get seated, then they will tell you a little about themselves. Gentlemen. Wear your mask if you want. When you need to talk, you can take it off. And who's going to start? Start to the left or to the right?
Belton, Grooms, Hill, Charles.
Milton, Stubbs, Doris, CFSD, Stubbs, Funeral Home, Bennettsville, Milton.
Dr. Toris, quick, owner of Quick Funeral Home in Bennettsville, South Carolina.
Jeremy, Bethea, Funeral Home, Bennettsville.
Well, we're so fortunate, we're so blessed to have these gentlemen with us tonight. Miss Tracey McLeod-Williams of Morris Funeral Home, she was supposed to be with us on this afternoon, but she had an engagement that she forgot about when she consented. But nonetheless, she gives us our blessings and we're going to move on. Tonight, we are going to talk about how COVID-19 has changed the way we do funerals. The traditional way that we in the African American community have done funerals, we've had grand homegoing services. We come in, we give God praise, we shout, we have scriptures, we have prayers, we sing, and we cry. And we just enjoy being together. Many times in the African American community, that's the only time families get together in peace. But COVID-19 or coronavirus has changed the way we conduct funerals. So we're going to begin our panel discussion tonight. And the first question that I have here is, can you get COVID-19 from a dead body? And so I'm going to let, I'll let each of you, I'll let Dr. Quick answer that for me, because he and I had this conversation earlier.
Okay, I have looked and did some research on it, and speaking as an embalmer, I've talked to some folks, and one of my good friends is an embalmer. What we say, we do trust the embalming process, but we also say that the embalming process has never seen COVID-19. So I tell folks, my grandmother said, I'd rather be safe than sorry. But I tell folks what I would say, the understanding I have now that I've read, there has not been a case where it has not been documented that someone has received COVID from a body that is deceased or from a body that's been embalmed. So that being said, we try to encourage people not to touch a deceased person who has died from COVID, but at the same time, we cannot definitively say that it isn't. But speaking, like I said, speaking as an embalmer, I trust the process. Now, I'm a person that I look at how it's being done, the disinfection, the just making sure you wear PPEs. You just have to do more. You have to do more than what you would do. Well, actually, if you do what you're supposed to do, you'll be safe as an embalmer. So if you're keeping yourself safe, you're also making sure the families you serve are safe. I feel like I don't think it's safe for the person to be viewed, whatever that situation is. I'm not gonna let my family be in that, the families I serve be in that situation. And they look to us to be able to give them that answer because they expect, I'm not gonna go to the dentist and ask him, tell him how he needs to clean my teeth. He ought to know how. So they expect us as funeral directors to know what our job is. So I would say, a quick answer to your question is, I'm gonna say there is no documented case of it. We're gonna say no with hope, but we're saying now there's no documented case of that. And my personal feeling, if there's no documented case of it, that's pretty good. That's a good way to feel pretty safe with it. So that's where I stand with that.
Thank you, Dr. Quill. Next, and I'm going to direct this question to Reverend Bethea. Being a pastor and also a funeral director, what is one of the ways a church, a pastor, can assist the morticians in helping families plan funerals at this time?
Well, I would say that basically, the pastor is over the direction of his or her church. So basically, if there's a situation whereas, let's say if I have to go with a pastor and meeting with a funeral director, then I would explain to them, what our particular policy is during the pandemic. One of the things I'm grateful for now is that it seems as though all of the pastors in this area are on the same page and not allowing funerals to take place in their church. And with everything going on, with all the uncertainties, wanting to keep everybody safe, and so we've had to become creative along with the particular ministers on how we want to conduct funerals. And so far, everyone's working together.
Thank you. Mr. Grooms, Belton Grooms from Grooms Funeral Home. Tell us the reason and talk to us about the importance of wearing masks when families visit or when families come to make their funeral arrangements. Tell us the importance of the mask.
The importance of the mask is that the virus itself is spread by droplet infections. They say that a 6-foot distance is a safe distance to be away from people. However, if you use a mask, you're neither breathing nor you'll let these germs get out. And that along with sanitation, hand sanitizers, most funeral homes do keep masks available, and they do have signs on the door saying that please do not enter without masks.
Amen. All right.
Not only that, even with that, we try to cut down the number of people that come through the funeral home at one time.
Okay. That was going to be my next question. Mr. Stubbs, tell us about how COVID-19 has changed the way we do visitations at the funeral home.
Our visitations now have been set to accommodate to make sure that the transmission of the virus is not transmitted on your premises. So in the meantime, we have set up stations at our entrances, notes on the door stating that you must have a mask on. At our facilities, we do take temperature checks. The CDC says 100.4 is a cautionary number you can go by. If you have that temperature when you are trying to enter our facility, we kindly turn you around and ask you that you seek medical attention. We document your name and number and information, and then those who have come in contact with you during that time, we do that on our facilities. We let them tested if they may choose to. But temperature checks, sanitation of the hands and so forth, and we do not let no more than 10 people in at a time. Therefore, we can govern and so forth, to make sure that we have a handle thing. Most visitation, you know, when people come in, they try to come in droves, and it's kind of hard to try to deal with them at one time. But we have people in place at the door to let you know 10 people at a time. Please be patient, and we'll allow you that time to come in.
Thank you so much. We know that traditionally in the Black and African American community, most of our funerals have always been held inside the church or in the chapel of the funeral home. With COVID-19 being the way it is, now 95% of our funerals are held on the outside. So I would like for each of you to tell us the importance, how you see the family, the importance of the family, and having this, the importance of, I'm sorry y'all, the importance of having the service outside when we can't have the service on the inside.
Well, I'm thinking that having the service on the outside, obviously, because we're trying to keep that distance, and with the distance on the outside, you have people that are able to be used. I've seen folks at services where they're sitting back in their cars, or I've seen folks may walk up to the cemetery, but they don't come too close, but they just wave their hand to the family to show their presence. And I think that that's one of the things we have to do is we are going away from having the inside chapel services, but I still think you can be creative, like what I've heard my colleagues say, as far as like having a private viewing. What I try to do for the families I serve is give them a private viewing. But I think what's important is that when you make that initial call to that person that's in charge, the person that has called you, I start talking to them then about COVID-19. I start explaining to them the policies. I start explaining to them, you know, we're going to have a private viewing. We're going to have 10 people at a time coming in. If you want to have a service, we're considering a graveside service, and that number can go up to 50 or whatever. But I think that's what's important for us to do is that initial call, that initial conversation with that person in charge. You need to tell them what they expect. And what I find is they will be that liaison with you and the family. So that when you have folks, like Brother Stubbs says, you have them coming in, you got a bunch of folks outside your facility, it is easier to kind of control them as they come in, because I think I'll turn into a bouncer at my door. I mean, you come to my steps and I see your teeth, you're not coming in. I'm not looking at your teeth. If I see your teeth, you turn around. But I think that as soon as they walk in, we get the hand sanitizer to them, and like you say, please be patient. And what I found is it goes fast. The folks know we're doing that. So they come out, 5 more come in, and we keep rotating to everyone outside. It's an opportunity. Now, I had someone say it before, well, I've seen people outside, and once they leave, they don't have a mask on. Well, they may not. We can't control that. But I can control what happens inside my building. You must wear that mask. You must be social distance, and we must do these things because it's about saving lives. And this is what we got to do, and they expect us to know.
Well, I'm very appreciative of the community who have really adapted to having the graveside services. You know, whenever the pandemic came, we didn't know, you know, how it was affecting people, that sort of thing. And really, we were just trying to figure out, you know, if we would even be able to have funerals, because there was much talk in the funeral industry, and some of us are members of the Mortuary Association. They sent some guidance on, you know, how to conduct things. But back to your previous question, Reverend Smith, you know, the pastors, they simply closed their church doors. And so there was nothing left to do other than have a graveside service. And probably at that time, initially, most of us were not having chapel services. We have them now, but they're limited to 35 people. And so everyone is kind of adapted to the graveside services, and you just have to be, you know, creative in, you know, what you are doing. But so far, everything is working out well. I'm kind of thinking of what's gonna happen when the cold weather comes. But for now, the gravesides are working out very well. And actually, many families are able to have more people at the graveside than they would be able to have inside the church, practicing social distancing if the church was to allow you to go inside.
A lot of that, if we can get the medical director and the person that's in charge of doing the arrangements to maybe alleviate a lot of things that we normally do in church service. Pastor Smith, I did for me, when it's 100 degrees, and people in the sun or under a tent, that heat's getting to be very difficult on people. But, when you alleviate a lot of things that you normally do at a regular, traditionally, inside church service, it's certainly very conducive to the pastor and to the family, and definitely to the field there. Oh, yes.
Graveside services have been unique in these past couple of months. Where, like Brother Grooms said, that a lot of these services have to be cut down as far as, a lot of folks like a lot of saying, a bunch of remarks made. But when you got 100 degree weather and a lot of heat and no wind blowing, it's causes for disaster. But we have adapted to the times where, there's 2 chants, maybe 20 chairs. But, and most of my colleagues can tell you that you can't do it when people can't come out to the cemetery. I believe the last graveside service actually had about 200 people out. So we had pushed them out of the perimeter. Most of those did not have masks. They wasn't socially distancing. So, but they look at the funeral and there's a bag out, but we have to, our first priority is to protect our families. Not only our families, but our staff and ourselves. But most of us, Bethea, and Grooms, we have families. And we don't want to take this stuff back to our families. So we have to do what we need to do in order to protect ourselves. So we also ask to wear masks and hand sanitation. Try to avoid not touching anything at the graveside and so forth. And especially with our COVID cases, Dr. Quick said that it's done known. There has been no trial study, there has been no case. And basically, we have to handle it like we did years ago with AIDS. When AIDS came on the scene, we didn't know anything about it. So if we use our necessary precautions, PPE, protect ourselves at all times, 99.9% of the time you protect yourself.
Thank you. We have a question here. As morticians, do you ask the family if anyone that's coming to the funeral home, have they had COVID-19 or do they have COVID-19? Because I've heard stories of people knowing they have COVID-19, but that's my mama. And ain't nobody gonna keep me from seeing my mom. Ain't nobody gonna keep me from seeing my daddy. And they insist on being a part of that service. They insist that they got to go to their funeral home. So the question is, do you ask the family members before they come in, before that person walks through that door, do you ask them questions regarding COVID-19?
I can start off. When we get the initial call to the answering service, that's one of the questions our answer service asks. Is this COVID-19 related? Once you relay that information to us, one of our directors will call, will ask simple questions. In the last 2 weeks, have you been diagnosed with COVID-19? Have you been in a household with anybody that's been COVID-19? And these questions are asked to each individual, whether you have COVID-19 or not. Then, if it's been determined that you have COVID-19, then we use alternative methods to go ahead and do the arrangements. Teleconference call, Zoom, everything to that point. If there's a person that had COVID-19 and wishes to want to come see mama, we'll do it through Facebook, pictures, or whatsoever. But you will not gain interest to our facility at no time, at any time.
I think for me, and maybe I'm old school, to me, everybody got COVID. I don't care whether I ask you a question. I count about 90. To me, every person I see has COVID. I would treat you that way. I would treat you with that same mindset. And I think because I think one of the things that's so strange about this virus is that it has so many different symptoms. It's asymptomatic. A person may have a fever, a person may not. A person may have a temperature. That temperature thing is not 100%, but it is one of the indicators. But you've seen, I talked to a nurse down in Florida recently, and she indicated to me, she was at a service I was doing, they had a patient that was 29 years old, and the person, they tested him 3 times at the hospital. He tested negative. But he had symptoms. The doctor ordered a biopsy, and the coke was in his lungs, and after that he was intubated. So I'm saying that to say that this animal is an animal we have not seen, and at the same time, what I tell folks, as far as like what Brother Stubbs was saying, when I get that call, I had a call not too long ago, I do with the hospital. I had a person call me, and they said this individual has passed. The first question I asked, was this person COVID? The nurse told me, I don't know. I said, well, call me back when you do know. Call me back when you do know. Because I need to know that. I need to know if the family members have been exposed, because more than likely, if that person has passed, the family may have been exposed. So you automatically assume that. So I tell folks, my grandma said, better safe than sorry. Treat everybody as if they are, because we don't know. We don't know what this thing is doing. We may find out something next week that is doing different than what we found it initially, because we were told initially that it was a virus that affected the elderly. It affected people 65, 70, and 80, and those people, and now you're hearing about a 5-year-old that passed, a 70-year-old that passed, 29-year-olds that are passing. So I tell my staff, I tell my family, treat everybody like they're COVID. Treat everybody that way. Sometimes my sister and I travel together. I fight with her about wearing a mask. And sometimes I'm in the car, I'm leaning on the driver's door because she have a mask on. But I tell people that we have to treat everybody as if they are, because that is how we're going to stay safe until there's a vaccine or until God says enough. When God says enough, we'll be ready.
All right. Everything in this room.
When most of us were in mortuary school, our instructors always stated to us constantly to treat everybody, every dead person, as if that body is contagious. And so with the virus out there, with individuals coming into your facility, you have to treat everyone as if they are contagious. And so that's why we ask everyone to wear masks. That's why we ask when you come in, you go to the sanitation station. That's why we only allow a certain number of persons in the building, period, and especially during viewings, because you don't know. I mean, you can look or feel as healthy as a horse, but still carrying the virus. And at the end of the day, as already been stated, our goal is to keep everyone safe, whether it's the people that we serve, whether it's our staff or us as directors. We want to keep everyone safe. One of the things that I do is when a person dies of COVID, and they're known to have died of COVID, and I do want to mention this, that in Marlborough County, if you look at the stats, it may say 4 COVID deaths or what have you, but I don't know where that information is coming from. But more people than that have died of COVID in Marlborough County, and I think that my colleagues can attest to that. But one of the things that I do when I know a person has died of COVID is, I want to ask, where was that individual? Were they in a nursing home where visitors were not allowed? Were they in a hospital where visitors were not allowed? Where did they die? And then I'm leading into what kind of contact did those family members have with that individual. One of the things that I think that all of us probably are facing is just educating the public as it relates to COVID. Because some people, everybody's not dying, or a small percentage. So there are a lot of people who feel as though, well, it's like the flu or to be affected. And so they'll have it and perhaps know that they have it, but continue on, as if they don't. So we have to make sure that we are educating the public and explaining to them the reason why we do what we do in our facility and at funerals as well.
Again, what's so alarming about the death rate recorded in different counties is the county that person died in, that's where that death recorded. We get them from Florence, Warrenburg, or different places like that. Even though they're from one county, because of the small amount of hospital space, these people transfer to different places. Again, your best defense is to protect yourself, wear masks, try to stay from around crowds of people. And, on some occasions now, I leave an option to the family whether they even want visitors at the house. And most of the time, we don't even take chairs, no bad, let it stand. Because some families are just reluctant about people coming and visiting during this time.
And to hear Brother Grooms say that's what we've done as well. I've had families that I've served. I had a lady one time say to me, Dr. Quick, don't bring chairs to my house. I don't feel think they can sit up in here. And that's one of the things that we need to be mindful of, is that if they want to, they can go on our websites and they can express a condolence. They can drive by. I've seen folks go by the family's house and they had baskets outside and put a card of condolence. But those days of somebody sitting up in your house side by side, coughing and sneezing, those days are gone. And I think what we have to do is we have to be mindful of the fact that this is something, when you wear a mask, you're protecting me. When I wear a mask, I'm protecting you. So I tell folks all the time, insist on people being around you wearing their masks. Because sometimes I'll see people where one person has it, the other person doesn't have it, and they're like, well, I'm okay because you don't have it. But you just don't know. And I tell folks that's double protection. They're telling us now, when people are singing, when people are preaching, that the droplets are further out, they're spread out more. When you're singing, it's going further out. We've heard the cases in Albany, Georgia, where the 2 funerals were attended, everybody came back positive, and the preacher who preached it was deceased from that. So we want to make sure. Now, I was thinking about what Pastor Smith said recently about when you got a person that comes in and says, I want to see Mama, I don't care about this, I'm positive, whatever. Well, then you might have to start doing some waivers and doing some private stuff and say, hey, if somebody else comes positive, don't say this to me, because these things have been explained to you. If the person is embalmed, and I think there's nothing wrong with keeping that distance and keeping that maybe a veil or something to remind them to not touch, but we have to realize and try to explain to folks, it's a very emotional time and we get it. But the thing they have to understand is that, and I say this, Pastor, and I say this respectfully, and I had a minister friend of mine say this, the dead is conscious of nothing. These funeral services that we have are for the living. We're trying to make sure that the living are able to give their memorials, they're able to honor the individual that has passed, but the person who's gone on to glory, and to go ahead and take that scripture further, or take another scripture further, be absent from our bodies, we are present with the Lord. So that person that's in that funeral home that's deceased, they have no worries, no concern. Those of us who are living, we got to make sure that remain living. I had a gentleman say to me recently, he said his daughter wanted to come visit him from another state that was a hot spot. And he told his daughter, he said, well, I love you. He said, I want you to come visit me. I said, well, you tell her I love you, but I don't love you to death. I love you, but I don't love you to death. So we have to, like Brother Bethea said, Reverend Bethea said, we got to do other things with our Facebook Live and do more creative things so that we keep everybody safe. It's not about disrespecting families. It's about doing what's safe so we all can live past this. Because we're gonna get past this. We are. God is in control, and I trust Him.
If I can comment on one of the things that Dr. was saying, when he talked about home visitations, and I think one of the things that the public needs to know is it's okay if you put a note on your door stating that you're not accepting visitors, because we're just not operating in normal times. And I've heard families say, well, I don't want people at my house, but they still want a door badge on their house. And you're trying to explain, if you put that door badge up, you are inviting people. or people who will say, well, I want a tent up because I don't want people in my house. Well, if you put that tent up, you're still inviting people to your house. So it's okay if you say, I don't want anybody there. I mean, people will understand because we're in the midst of, we're in the midst of a pandemic. It's just like someone being in a hospital. You would love to go visit them, but you can't do it. They won't allow you. They won't allow you to do it. And funerals is the biggest spreader in the African American community. Of course, it's at funerals. And one of the things that we have to do, even when we're having the graveside service, and oftentimes, and I'm not picking on the preachers, but oftentimes it's the preacher that's leading it. He goes after the service in front of everybody shaking hands. And sometimes you have to go and say, please don't shake their hands, or please don't hug, and those sorts of things. But here again, times are not normal, and so we have to act accordingly.
Yes, sir.
COVID-19 has changed the way everybody thinks. One thing that we did not touch upon is inanimate objects such as door handles, the door to your bathroom. These things should be constantly sanitized because so many people touch them, and that virus can't live on that object for a short period of time.
Like Brother Grooms is saying, and that's true. That's why I adopted the idea of when I have a visitation or a private viewing at my mortuary, I work the door. I'm the one who's touching that door handle. I'm looking who's coming in, and I'm spraying it. And when they come in, I'm sanitizing their hands. And if by some chance because the door is going to be locked, so once they touch the door, then I spray it again. But just like what Brother Grooms was saying, it's all in the interest of being sanitizing the things that we touch, especially things that are commonly touched. Touching that door handle to the bathroom, touching the faucet, getting the paper towels, even putting your hands on the soap dispenser. Those things have to be sanitized. I sanitize my hearse. I sanitize. And one thing, and I want to mention this, even as far as like putting families in your cars, I've even reduced the number of people that I put in my limousines. I normally have 7 people per car. I reduced that to 5. And the reason I do that is because I'm putting 2 per bench. I used to do 3 per bench, but I do 2 per bench. And if for some reason I want those 2 that's on that bench, I want them to be in the same household. I want them to be people that I don't want people in the cars, and I explain it to the families that when you make this car list out, make sure the people that are going in this vehicle, that they are from the same household, that they live together, and if they're not, then we need to change this. And then once that service is over, that limousine is sprayed down. Those door handles are sprayed down, those seats are sprayed down, that car is clean for the next service. So these are like Brother Grooms is saying, we have to do everything differently. We have to do a lot of things differently. I tell people, what makes you feel comfortable, now make another person feel comfortable. I've been in barbershops where the barber wants you to take your mask off when they cut your hair. I don't like that. You got your mask on, mine on too. But I tell folks, we have to do what makes us feel comfortable and make people feel safe. It's not a political thing. I tell folks, listen to your physicians, not your politicians. Listen to the physicians. Listen to individuals who are studying this. Listen to epidemiologists. Don't listen to someone who does not know what this virus is able to do. So we gotta stay safe.
All right. Thank you for that. We have another question here, and this is something that we in the African American community, we have a fear of, and I know that in the northern states it's common, and that is cremations. Mm-hmm. Can you tell us, can each of you or one of you address cremations and how we need to be educated more about cremation?
Well, I feel cremation is what a lot of countries are really doing. I did some research, and there's some places where if a person is designated as COVID-19, cremation is all they're offering. That's what they're doing. Of course, that's the most safe method, and of course, you can do memorial service after that. But when you do cremation, one of the things that if a family decides to do cremation, they then can do a memorial service at a later time, at their earliest convenience, or hopefully when the pandemic is over, they can do it then. But I've had where people have decided to do a private service body's not there, and then there's no longer that fear of that COVID person being there. There's no longer that fear that I think for us as directors, that does, as embalmers, what that does do, if a person is opted for cremation, we're not having to handle that person as much as if we're trying to prepare that person for, ultimate disinfection. When a person is cremated, you can take them directly to the crematorium. Once the paperwork is done, you can go for refrigeration. Embalming is not required for cremation. So that's another thing where we're keeping ourselves safe, but it's also less expensive for a family that may be struggling. So I think cremation is definitely an option that people can use, but at the same time, we still gotta let them know they can still do a service at their earliest convenience, but we have to do what's gonna keep them ultimately safe.
Other comments?
In regards to cremation, and I think my colleagues can agree, our community is kind of, unless it's a financial situation, most of our families prefer a traditional burial. I've had some families that would want a viewing, then go into the cremation stage. Cremation is the safest way during this time of COVID-19. New Jersey, the upstate, where those states, they run out of burial space. The medical examiners, the board funeral directors, and so forth, they come together and say, well, cremation is going to be the only option. But now the crematories are being backed up there. There's no room. There's no room. And there's a backlog of doing the cremation process where, you have to wait, South Carolina, 24 hours before you can have the consent to cremate. And after that, you have to have the permit from the county of Bethea. New York, they have the corner, but they have waived all of that just to get these bodies cremated and so forth. So cremation is an option, but in our community and the clientele that we serve, most of those have basically want a traditional burial.
Any comments from the room? All right. Well, as we get ready to bring this discussion to a close, we want to say thank you for joining us. And at this time, what I'm going to do, I'm going to give each of our morticians the opportunity to give closing remarks on our discussion this evening. And again, we say to our morticians, thank you for being a part of this discussion.
Thank you for inviting us. My final offer is to be safe, and to Agape Hospice, the entire staff. I'd like to thank y'all for a phenomenal job y'all do.
Again, Reverend Smith, thank you. Mr. Lewis, thank you for allowing us time to have this roundtable discussion. If there's anything that I can leave for our community at large, is just basically be safe and be wise. We are living in times of uncertainty. Hopefully in the next couple of months, we can soon have something that will treat this. But in the meantime, you have to be cautious of yourself and others. We as young directors, we've done the best that we can and all that we can to make sure that our clients, our families, and our staff are safe. If anything that I can leave with you, please wear your mask at all times. If you can't socially distance, hand sanitize, and please refrain from having groups of more than 10. Therefore, you won't have to worry about the transmission of the virus. Again, we thank you for the opportunity.
I echo my colleagues. I agree that we have to keep ourselves safe. If I would leave anything, is that we do need to educate ourselves. We all have access to the internet. We have access to people we can contact. Do your research so that you are comfortable. I think the more people educate themselves, then we as field directors, when we have to work with our families and we have to say to them, we have to do this or we can't do this, they'll already be expected. So when that expectation is already there, they know the reason we're doing these things is in the interest of keeping everyone safe. It's not to be difficult or to be hard to get along with. It's making sure that we all are able to live past this pandemic, which we're going to do, and be able to go back hopefully to the traditional services, and we may not. And like I tell folks, we do have to do things differently. I have not shook hands since January. I have not shook hands since January. And I tell people all the time that these are one of the things that we have to change, is the way we do things. When we know better, we do better. So I just want everybody to stay safe. Wear your mask, wear your mask, wear your mask, wash your hands, stay distant, stay distant, stay distant. So I said that to say this, and again, to Agape and Hospice, I thank the world of y'all. They do an excellent job. Mr. Don, I've seen him before, and Reverend Smith, she was doing this before she got the job. She was doing that when we personally contacted, and doing all the things she does for 13 months. She was doing that for free for me. So I'm thankful for that. And Pastor Woods, he's an awesome man of God. I love him. And I'm just so grateful that they are the individuals that are doing this for our African Americans in Mortuary County. God bless everybody.
I certainly want to thank Pastor Smith for the vision that she had to put this forum together. There are yet still a lot of people who perhaps have not experienced a loss in their family, which is a good thing. But, you know, there's still a lot of questions out there in terms of how funerals are conducted and those sorts of things. I certainly want to thank her. And I would simply want to say that I hope that the churches, pastors, funeral directors, along with our families, will continue to work together so that we're still able to hold services. May not be as traditional as normal, but we're still able to give our loved ones a proper homegoing celebration. And also want to thank my colleagues, because we're all in this thing together. None of us have served families, as I said on another forum, Pastor Smith, none of us have ever served families in a pandemic. And so we are doing the very best that we can. We're using the resources that are available to us. And here again, may not be able to give you everything that you want, but all of us are certainly going to do our very best to give you comfort in your time of need.
All right. I just want to say before you turn the cameras off, we want to say thank you to all of you for joining in with us. And I would be remiss if I did not thank our camera people, Deaconess Jonathan Johnson and Brother Tyrone Abraham. Thank you for serving us tonight. Thank you for helping us tonight. And to all of you out there in Facebook land, I pray that you have gained some knowledge tonight that will help you as we endure this coronavirus pandemic. Thank you and have a great evening.